Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a topic that many of you have asked about, and I know is extremely important to many of you as well, and that is, how do you rejuvenate your mouth, your lips? How do you get that sensual, youthful, beautiful mouth and lips back again without looking unnatural and without looking like you've had something done? Well, this is actually a lot more of an interesting and complicated topic than you might think and the way you've thought about it before. And I think after we get done discussing how the mouth ages and then subsequently how we rejuvenate it, it's gonna make a ton of sense, and it's gonna put you on a path to not only get a better long-term outcome with this, but also to avoid all those nightmarish type of outcomes that we're always so worried about, which is looking unnatural and looking duckish and all that other stuff. It'll also put things into perspective, so myths that you've heard about or thought about will literally disappear, and you'll have good context and empowerment to be able to make the best decisions for yourself. All right, so without further ado, let's break it down. One of the most powerful things that you can do as a person is be your own self-advocate. And that's true for anything related to, cosmetic, rejuvenation, God forbid, real health-related matters, cancer, heart disease, etc. You want to be in a position where you know what's what and you're able to advocate for yourself. I mean, there's a huge purpose of this channel to give you the tools and the understanding to be able to sit across from a provider, sit across from a surgeon, and basically know what's best for you, right? I mean, that's a good place to come from. So when they give you recommendations, you can judge those recommendations against what you're hearing here today, and if this makes sense to you, then you can kind of negotiate and discuss back and forth and make sure that you guys are both aligned in the right way, as opposed to blindly trusting and blindly following recommendations that somebody gives you, right? I just think it's a good place to be from. Now, when it comes to the lips, we have been traumatized by so many unusual, unnatural looks that as a result, our spouses, our friends, ourselves, we're afraid of it. I mean, it really becomes a fear of getting it wrong, and as a result, becoming sort of like that cartoonish character, becoming someone that people kind of talk a little bit like, whoa, did you see what, we don't want that, right? We want to go under the radar. We just want to look the way we feel, right? As youthful as we feel, we want to look beautiful, but we don't want anyone to associate that with a procedure. And if it's done naturally, if it's done with the right perspective, like all the other stuff that I've shown you guys with all the facial rejuvenation work that I've done with the vertical restore and fat transfers and all that stuff and how natural and beautiful everything looks, it comes down to the proper techniques and the proper choices. And this is a little bit about both, but mostly about choices. So let's start off by understanding how the lip ages. Right? How does a lip age? Why are we even in the position to even be talking about this? I rarely break areas down into subunits, but I do that from time to time to get a little bit more in depth with it. We've done that with the lower eyelids, we've done that with the periorbital region in general, and then we sometimes go back and talk about, the whole face. But right now we're going to talk about the mouth. So what I define as the mouth is basically the space underneath your nose to essentially, above your chin, this region right here. Like the other parts of the face, it comes down to three simultaneous changes that are happening. There are changes that are happening to the skin, there's changes that are happening to the volume, and then there's things that are happening to laxity. Now, depending on what age you're at, all three of those things can be happening simultaneously, or they could be happening in stages. So for example, you might lose some volume, but the skin is overall in good shape. Or you might lose volume, but you haven't seen laxity yet, right? So depending on where you are, and I would just say that volume loss is a process that begins somewhere in our 30s and continues going forward. Laxity is something that generally starts around our 40s, like mid 40s and beyond. So when we're talking about skin, however, skin quality changes in a negative direction from our 20s on. So there's thinning of the collagen, loss of elasticity, all that stuff that's starting to happen beginning in our mid-20s, but then it really accelerates during perimenopause and menopause. So again, late 40s and 50s. So what are those changes? So let's break it down. So when it comes to skin, what we're seeing is that there is a thinning effect of the skin there is a loss of elasticity which manifests in these vertical lines that you see. So when you see people or yourself smiling or whatever, sometimes it's dynamic, meaning that it's only there when you're actively smiling. And then in other cases, as you get older, it's there even when you're not smiling. Your face is completely fine. There's these like deep lines in this area. That's an evolution. Just like the evolution of the glabellar lines, you see it here, or the crow's feet lines. Those areas like the 11s and the crow's feet, that's from years and years of the skin banging against each other. In the process of loss of elasticity, those consistent creases ends up creating lines. So it's an evolution that starts with loss of collagen, loss of elasticity, that eventually become deeper and deeper, and they're there. So the whole goal when it comes to that is to stop that process from evolving. Now, not to complicate it, but it is a little bit of a complicated and intertwined story, because the collagen is diminishing, lines start to form, but also as the lip gets longer, there's just not as much robust volume, so there's more space for these lines to crease, right? So you can picture something that's like taut like a balloon. It has less room for it to move like this, versus when it gets thinned out and longer, then that muscle movement leads to just more surface area for these lines to crease. So there is a little bit of overlap between that aspect, but the manifestation on the skin is vertical lines. Volume is what we commonly think about when it comes to lips. We look at it as like, it's like this nice full lip starts to thin with time. So what do we have to do? We just got to put some filler back and we're good. Well, guess what? When you're in your 30s and you put a little bit of filler back in the lips, yeah, absolutely, you've got it right dialed in. You look like you did when you were 20s. But when then you get to your late 40s, 50s, and 60s and you put filler into your lip, suddenly things start to look a little off. You start to actually have a little bit of that duckish look to it. And I'm gonna explain why that is. That duckish look is not because you put too much filler into your lip. It's because the lip anatomy has changed, which leads us to the third change, which is sagging of the upper lip. As that lip gets longer, the red part of the lip starts to invert into the mouth. That inversion into the mouth causes less red lip to be seen on the outside and more red lip to be facing the teeth on the inside. So when you go into med spa or dermatology practice or plastic surgery and they're putting filler into the lip, it invariably ends up causing the filler to go on the outer part of the lip, causing the lip to protrude forward. Now remember, the proper ratio in general is that your lower lip actually sits in front of your top lip. Like if you look at it on the profile, the side view, it sits a little bit further out, and it's fuller than the top lip. And so when you end up in a situation where the lip starts to elongate and fold inward, you see less red lip, which kind of really throws off this ratio, forces the injector to want to put more volume into it, causing the lip to kind of protrude out, and all of a sudden now you look duckish and you don't even accomplish what you hope to accomplish, which is to regain that fullness that you once had. Like I said, things are actually simple when you understand them, but on surface, and once you get into it, you realize that there's a lot of moving parts going on with this aging thing. So I hope you're tracking with me. I hope you're following along, because to summarize, we lose collagen, which makes our skin thinner, more susceptible to lines and wrinkles. The elongation process causes the lip to fold inward, less red lip to show, so you look like you've actually lost some of your lips. But then there's also volume changes that are happening to the lip and the tissues around it also, which is real. There is fat pads in the lips, and those fat pads begin to diminish. So you actually do shrink, you lose visible lip, and things start to, now that's the aging lip in a nutshell, right? And depending on where you are in that continuum, you're gonna be treating different aspects. But I'm gonna explain how you can identify and what the treatments are associated with each of these. If you are in a 30-year-old group and your lips are just thinning a little bit, the answer is gonna be volume. Take a little bit of filler, go to your place, have them put a little bit of Juvederm or whatever, Restylane or some other filler, and just bring a little bit of that volume back. Do it tastefully, make sure it's done naturally, not a huge amount. Remember that era where the Kardashians were putting in there was like this massive lip thing. All of a sudden everyone wanted like 2 or 3 syringes of filler in their lip. And it was a disaster, everyone looked terrible. And then all of a sudden everyone wanted it removed. But really at the end of the day, it's just about replacing some. So a little bit of volume in the lips can go a long way. You don't need a huge amount. if you're in your 30s and early 40s. As you get a little bit older, you gotta start looking at the lip length, right? How long is that lip? When you're younger, your lip is somewhere between 13 and 15 millimeters. That's the average length. When I say that, and you can go and measure this, it's the distance between the bottom of your nose to the top of the lip. That distance should be about 13 to 15 millimeters on average. It can be a little shorter, it could be a little bit longer, but that's the average. Then what ends up happening as you age, that top lip starts to get longer. Now all of a sudden the lip gets to be like 17, 18, 19, 20 millimeters in length. Because backing up to conversations I've had with you all about how the face ages, the entire facial aging process is the fascia getting longer, and that's why you get jowls and neck laxity. And in the middle of the face, you got lip lengthening increasing, eyelids increasing, and all of that is just this elongation process. So when that happens, putting more filler is not the answer. Putting Botox or some other treatment for the lines, which I'll talk about in a minute, is not the answer. You actually need a procedure called a lip lift. Now, the caveat there is if you do a lip lift by itself and all this is long, it looks weird. So really the lip lift has to kind of go with a procedure that's going to shorten the entire face, or else that looks a little funky. But depending again where you are on the spectrum, you still might benefit from it, but it doesn't always look right because this gets shorter, but this is longer and the proportions are off. But just know the key here is that you shouldn't be putting more filler into your lip. You should wait, let it all do its thing, and eventually when the time comes, have a procedure that lifts you and does a lip lift at the same time, and then you're gonna have good balance and restoration back. The key though is that when you are in the earlier stages, something that can really help with those dynamic lines is Botox actually. So when your lips are creasing when you're talking and doing this and you get the little lines there, a little touch of Botox, couple units, 1 to 2 units on each side can really slow down that muscle, the orbicularis oris muscle, from contracting and therefore decreasing that evolution that I was talking about from that point forward. But the other benefit is that it can actually give the lip a little bit of a lifting effect and shortening that distance as well, just with a little bit of use of Botox. So if you're in the early stages, and this is something I've been doing for my wife for a while now, is just put a little bit of Botox in that area. It softens the muscle contraction, lifts that red lip up, and then adding a little bit of filler into that region can be very, very beautiful and useful. But it's kind of like the combination of those two things. But then going back to first principles, and I've done lots of videos on our Skin School series on this, is really, really important to keep that skin in good shape. So things like using retinols and vitamin C, sun protection, using microneedling and things like that to thicken that skin also can go a long way. But one thing I have to say you gotta be careful about is if those lines that you're seeing, and these are caveats, so if those lines that you're seeing are only there when you're moving your mouth, you don't want to fill them. Right? Because like I said, there's a point where it turns into lines that are there even when you're not smiling. Then when the lines are there when you're not smiling, that might be a good place to put a little bit of filler to improve them. Or you use resurfacing. Laser resurfacing, like a Erbium Miag laser, can go through and basically remove those lines completely from that area and smooth things out. That's something we do with a contour TRL. And we often do that in conjunction with surgery only because it takes a couple weeks to recover from that. But it's a great way of kind of sanding away those deep lines that are there even when your mouth isn't moving. But the best thing to do if you're catching this early is to prevent it. And the prevention really does come down to Botox. It's really helpful, just like it is in this area. And then generally speaking, when the time comes, look at lip lifts, look at volume augmentation. Now, when it comes to volume, just to revisit that, fillers are a great way to go if you can be mindful that you're using them in the proper situation and you're using them in small amounts. In surgery, I use fat transfer all the time, add a little bit of volume back. I don't recommend using fat transfer outside of a surgical fat transfer case because the fat doesn't take the way it does in other places, you might be disappointed. I still think fillers are the weapon of choice for volume augmentation of the true red lip. So I know that was a lot of information. I don't even know if this is gonna get you all twisted up, but I'm gonna try to summarize. In the younger phases, you're gonna use a little bit of filler, you're gonna use a little bit of Botox to improve the mouth. The fine lines, vertical lines, Botox prevention, a little bit of volume back. As you get a little bit older, you may be a candidate for a lip lift and volume augmentation. right? A little bit of volume augmentation, but you still may or may not need a little bit of Botox to help prevent those lines. If you're checking this out and that ship has sailed and you already have deep lines in that area, one of the key elements that you're gonna need to do is a deep laser resurfacing to get rid of those lines. Fillers can help a little bit, but sometimes it can make that area look a little heavy. So be careful, not too much filler into this area. A small amount might be able to be useful. Too much can make it look boggy and heavy. Laser resurfacing is better. And oftentimes, if you're at that stage, your lip has gotten longer, probably other things have gotten longer in your face, and that's when it's really time to consider doing things like the vertical restore and doing a laser and a lip lift at the same time to get all those areas treated in a proper way so that there's not mismatches. But the biggest landmines, the biggest mistakes you can make is if you're maturing and the lip is getting longer and you're seeing this, is overfilling them and creating that duckish effect. So I hope that puts a little bit of framework and perspective around this topic and gives you a little bit of pause and caution before just jumping into doing this or that. And even if you are a practitioner and you're watching this, gives you a little bit, trust me, I've made all of these mistakes myself. And so as a result, I'm coming to you from a place of experience and learning from my own mistakes. And this is the summarization and nutshell of the management of the aging mouth. And if you do it properly, man, the results are amazing, as you can see by these before and afters, how much of an impact the combination of lip lifts, augmentation, and in some cases lasers can make, and how natural and normal things can look without, crossing any weird unnatural bridges. So put yourself in the power position. Empowerment is key. Knowledge is key. Now you know. Share this with friends and family. This could explain a lot of things. It could also be a soft way of letting people learn about this so that they don't make the same mistakes. All right, folks, I hope you enjoyed that. If you have any questions, drop them in the comments below. If you haven't already, make sure you follow along by hitting subscribe, like the post if you enjoyed this, and share it with friends and family. All right, folks, thanks so much. Dr. Amir Karam.